Hey guys, it's Jay. Um, and today is April 7th, and tomorrow will be 1 month post-op. Um, that's crazy, cause healing seems like it's been taking forever. So it kind of feels like a whole month, um, but possibly longer. Um, so yeah, I haven't done any videos updated videos since about a few days post-op, and I could have, tracked a lot closer how I was feeling and things like that, but I just figured it'd be a little easier to do it in review. Um, yeah, my nipples, the incisions, everything was covered up, um, until the reveal, and then uh, just the tape and stuff, and like trying to do the zero form on my nipples and the nipple dressings. Um, nipple. um, it was just, it was really tedious, and it was just like, move this. It was just really, nothing was changing super fast. So, um, I'm doing this update now, and yeah, I'm just gonna talk a little bit about how I was feeling um, since the reveal, which was about a week post-op. So, how I've been feeling the past 3 weeks. Um, yeah, uh, it was really hard. The first week being all wrapped up and stuff. In review, that the first week was pretty hard. Just being comfortable. That was my task, making myself comfortable. Um, and then once the drains come out, you know, and you take the bandage off, and then it's your job to do the nipples every day. I feel like that's when the real work comes in, and that's when it's really hard because you're no longer in the doctor's care. Um, it's up to you, and if there's an emergency, obviously you can consult with the doctor. Um, Things like that. It just it's a little. That's when the shock sets in, and you're like, wow, I have this new area of my body that I get to tend to instead of ignoring all the time. So I just kind of went head first into like, wow, new chest, awesome, but scary, and just because I didn't want to mess anything up, you know what I mean? And when it's in somebody else's hands and you're, paying them to do it, it's like, oh, okay, they got this. I'm just gonna sit back, enjoy the ride. Um, so when it's in your hands, it's a little shocking. Long story short, started doing the nipple dressings every day. I could start to shower. That was amazing. You know, definitely do as your doctor says and only let the water hit your back and run over your chest. I was super careful about that. Um, I bought some Ive Cleanse. Not a lot of people talk about that. Um, it's a small blue bottle of surgical hand wash or wound wash. Um, Not a lot of people read the writing though, but if you leave it on your skin for too long, it can actually cause a chemical burn. So use the minimal amount, like drops. Put it in your hands, suds it up. It doesn't get very sudsy, but I put it right up here and then let the water hit my back and just let the water flow. I even kind of put my hands like this or like that over my nipples and just let as much water as I could get over it so that I was thoroughly cleaning the area after putting that Ive Cleanse stuff off, because um, even something that's like a cleaning astringent, if you leave it on for too long, it's going to dry out your skin. It's going to make it harder to heal. So use Ive Cleanse, but use it sparingly and wash it all the way out. Um, if you are starting your nipple care. And other than that, the next week just went by pretty fast in terms of getting used to stuff. I was just like, wow, my chest is exposed. I was really excited about that. Definitely revel in wearing all the shirts you never could. I just didn't want to wear a shirt. I was just like walking around with my bandages on my nips, like going crazy, being shirtless. Um, yeah. Um, just some fun times in that, and then, you know, uh, the I want to talk about the tape strips, um, that cover your actual incisions. So I have heard a couple people in their YouTube videos say they had some yellow or moist areas where the tape was coming off already. And for me, I was like so nervous. I didn't want to mess with the tape because it was like stuck to the other areas with dried blood. And I was like, okay, this is not coming off. Maybe if I just keep showering for another couple days and letting more water hit it, it'll come off easier. And that wasn't the case. That stuff is so sticky. Like, it's not going to come off unless you pull it off. And Dr. Garramone's like, if they don't fall off in a week, you can peel them off. So somebody else's video I had watched said that they had some yellow pussing stuff, and he was like, that's a sign of infection. I'm going to take all these off. And in my head I was like, I should take these off. I should take these off right now. The moment that I saw that little area. But in my head I was like, but what if, shoulda, coulda, woulda, whatever. But like in my head I was just like, man, what if I fuck this up? Again, the shock of like having everything in my hands. So I didn't want to mess with everything too much was my problem. I was a little timid, and I just kept washing the area. But I was like, man, this area is like really soft. The tape is not even sticking to it. Like, this is my chest, and the tape was like lifting off of it. Like, the tape would be flat in other areas, but right there, it was like already gone. And I looked, and I was like, whoa, it's like smooth there. Like, it's already healed. So I cut out that little place in the incision where it was lifted. I just cut that piece of tape off and peeled it off, and it was like completely healed. And I was like, oh wait, there's like this hole. There was a little tiny hole, and it was just like leaking fluid. And I was like, that's infected. And so I was like, I'm gonna peel all this shit off. So I peeled, excuse my French, but I peeled off all the tape strips, and that's like really hard, you guys. It's really sticky, so be gentle on yourself and take your time. But you will be amazed that once you pull the tape strips off, I pulled my tape strips off 2 days early. 2 days from 2 weeks post-op. So, a week post-op, you get your drains out. Dr. Garramone's like, peel these off in another week. 5 days from getting my drains out, I peeled the tape strips off. And was nervous about it, but I was so glad that I did, because when I peeled it off, everything was healed underneath. It's crazy how the body heals. So I already had that scar tissue, I already had the white line, you could see my incision, but everything was closed except for that little dot, and it was because I left that tape strip on there, and instead of getting some antibacterial ointment, some band-aids, and some cleansing wash on it, I just let all that stuff sit there for like a week and a half, almost 2 weeks, letting my stuff get infected. So I ended up having a hole in my incision, which I'll show you guys in a minute. I'm going to show you my chest at the end of this video, which is almost turning into a 10-minute video. Okay, and it was leaking fluid and stuff like that. Anyways, my nipples started to heal really fast. Top layer skin peeled off. He says, the top layer skin's going to peel off over the next week. That's fine. Don't worry about it. Just keep doing the nipple dressings. It sounds very nonchalant. It's scary. You're like, whoa. Are my nipples falling off? No. It's that bottom layer of skin is really in there, you guys. And that top layer of skin is just going to kind of like fall off in like pieces, Doing like charades here. But anyways, it comes off. That crater area is definitely going to push out after a while. The center of my nipples are still healing. So I'll just show you guys my chest now so that I can talk a little bit more about the problem area I had. So right now, this is my chest right now. Right here is where my left drain was. This is where my right drain was. This is so like completely smooth. It's not even funny. It's like great. But I don't know if you can tell with the lighting. Yeah, you can. This is puckered. I'm not happy with that. And I think it was just the way it was sewn, and I had a lot of pain with that drain. So I don't know if it was because um, there was a stitch missing or something, or when you pulled it out, you like pulled it, and it's like a little mountain. So if I'm walking around, I just be like, yeah, sweet. But you can see that little dip outwards. Um, and again, I had a quite large chest pre-op, pre-everything. So when he was drawing me up, he was like, wow, I'm gonna have to join your incisions because there's like that much room where I wouldn't be joining it, and it would cause some puckering. He was like, I'm just gonna try to make this as flat as possible with your permission to make it flat. Or he was just basically like, this is what's happening, Jay. I'm gonna make this shit flat. If you want it flat, this is what needs to happen. I was like, oh man, I really don't want my incisions to meet, but I just was like, I trust you. You know, I'm just gonna take care of my scars like crazy. So I don't know how well you can see this or how much I should zoom in, but um, I need to massage these because they're a little raised. When I wake up, it's pretty good, but there's a lot of scar tissue built up there already. Like, start your scar massage like super early. I'm kind of slacking, but the reason I'm slacking is because right there was a little purple spot, and that is where that hole was, and it was swollen right here. It's still a little swollen, but I was like, oh yay, I'm just gonna, get all that stuff out. And it was leaking a little fluid when I peeled the tape strips off, but it wasn't that bad. So what I did, I just put a band-aid on top of it, and I was like, oh sweet, because that's what they say to do. So it started to close up, and it was great. It was awesome, and I was like, sweet, I'm gonna start my scar massage right away. So I'm like going around. I started from here because of that area, and I was going at it for like an hour. I did it like 5 minutes in each place. I just really was like ready to get this scar massage going, and I'm just like lightly rubbing, like barely touching it right now. I'm just like, it got to here, and I pushed on the top, and I wasn't even on that purple spot, right? I wasn't even on that hole. I was literally in the middle of my chest, and I went like this, and I heard this squirt, and it like projectile squirted this. Trigger warning, it's just this crazy yellow sebum type stuff. Sebum is just like a healing fluid that your body secretes. And I was like, oh my gosh. And I pushed a little more, and I could hear this air bubble in here. And I was like, wow, like air got up in there and started to cause an infection in here. And I'm just like pushing fluid out at this point. I was just like, oh my gosh, I got to get this stuff out. And it was sore. And I was like, oh my god. And there was a little blood too. And the more I pushed, the more blood was coming out. And so I had to call Dr. Garramone, and he was on spring break, and I felt super bad. But call him. You know what I mean? I was like, if this is a life-threatening emergency and this turns into a hematoma, there's nothing you can really do, but you have to let them know. So, he was just like, just make sure you get all that fluid out of there, cover it with some ointment, and just be really gentle. So I thought I was healing really good, and then all of a sudden I was just like, whoa, I gotta take it easy, because I was trying to move and stuff, and stretch a little bit more, because I was like, okay, I got the drains out, I'm just like gonna try to reach for stuff forward, like small things. Still not lifting anything even at this point. And this healed up. There's just a tiny little scab, and I'm not messing with it. So I'm gonna change. Sorry, there's like a bunch of sticky stuff around right now because my skin is really sensitive to band-aids and stuff like that, and it's been really hard on me with the band-aids. So I bought like 3 different kinds of tape trying to deal with my sensitive skin, and that's literally the worst part of this. Like, your nipples are gonna be fine. So that is my left nipple, and it healed so fast. The center of it's still a little white and healing, but the nipple projection is definitely coming back. Um, the outside of it is ready to turn brown, and I'll do another update on my chest later. But yeah, that's my left nipple, and they got a little stretched, so that's probably because I was really uncomfortable when I was sleeping, and I had to like sleep like that and like that. But yeah, my skin's really sensitive to plasters and band-aids. So that's the 0 form. It's yellow gauze that is saturated with petroleum and some other lubricating agent of sorts. This is my right nipple, and he's doing good too. This little guy is fairly happy. Pretty bright red around the edges, dark red, and the center is healing a lot slower than I feel like it should. But it's fine. I'm about to be a month post-op tomorrow. I think I'm doing great because a week after surgery, he's like, you got 3 weeks left of nipple care at least. So for that to be right on schedule is really good. My little hole here definitely made me take it easier. So I'm really uncomfortable because there's a lot of built up scar tissue, and I can't sleep straight yet or anything. But I'm so stoked about this, you guys. Still, but I'm getting used to it. So I know the scar looks pretty gnarly right now, but I can touch everything. I have feeling and all that stuff. And I'll do another update about this because this video is getting to be pretty long. But this is my chest. This is the chest I've always wanted. Obviously, you see yourself and you're like, whoa, I look like Frankenstein. But you guys, this is crazy. Like, I'm a fairly skinny dude, and all my life I've had like almost triple D stuff going on, and I've got like a really tiny rib cage, so that was like giving me back problems, all that stuff. I'm 5 months on T, 5 months and a week on T today, and I'm kind of broadening out a little bit. Got like a little bit more muscle definition. I'm gonna do a transition video with all of my pictures and physique stuff up to 6 months, so that'll be posted next month. And yeah, I don't really have much of a following right now, which is fine, but I just really wanted to document this. So anyways, this is my chest, a month, just shy of a month post-op by a day. But I'm so happy I can't even talk about it. Like, I'm just, I'm free. So you guys, you know, everybody's gonna have their own journey, and just be with yourself the whole way through. Like, it's a big emotional transition, and I was afraid of being sad or something like that, and I'm not. I feel even more open about myself and my sexuality and my body, and how I want to express myself, and it's worth it to be yourself. So be yourself. Alright, I'll post a new video soon, and thanks for watching this 20-minute long video. Yay! Bye, guys.